Well, as coronavirus cases continue to surge, Regeneron announcing it is starting late-stage trials evaluating its antibody cocktail for the treatment of COVID-19. Meg Terrell joins us with the details. Meg.
Good morning, Morgan. Well, these are moving incredibly quickly. Regeneron only started human trials with this antibody treatment in June, and now they are saying they are in the late stages of testing these. And what they're looking at is really two different programs. One is a prevention trial that's going to be done in collaboration with the National Institute of Allergy and Infectious Diseases. That's going to be done in uninfected people who've had close contact with a patient with COVID-19, housemates, for example. The other is late-stage trials they're going to run in patients with COVID-19, both hospitalized and non-hospitalized patients, with those data expected later this summer. Now, these are going to be large trials. For the treatment trials, they're going to enroll 1,850 patients in one of them and more than 1,000 in the other, in the U.S., Brazil, Mexico, and Chile. And this drug is administered through an IV, whereas in the prevention trial, they'll be enrolling 2,000 patients, and that drug is given as a shot. So this is not a pill. It's not super easy to take, but they are figuring out how to give it outside the hospital. They do expect to have data later this summer, so we're going to be staying tuned for that. I also want to update you guys on the case trends we've been seeing over the holiday weekend. Holidays are always a little bit wonky with data reporting, but the trends still continue, seeing records in states like Florida over the weekend. In the United States, daily cases, you can see there have been rising. Hospitalizations are also starting to rise as well. And though we are seeing the daily numbers of deaths still declining, experts say they do expect that to start to pick up a few weeks after the hospitalizations rate as well. In terms of the states of major concern, Florida, of course, reporting more than 10,000 cases yesterday. California, Arizona, Texas, Georgia, those all also of concern as well. Multiple states, according to Evercore ISI, are at a peak on their 7-day average, from Alabama to Montana, New Mexico, Ohio, Oregon, South Carolina, Tennessee, and Wisconsin. So, guys, trends in many places in the country still going in the wrong direction. Back over to you.
Yeah. Hey, Meg, it's David. Obviously, we mentioned that at the top of the broadcast, with the market still going up. But I wanted to come back to antivirals because, I've been making, or at least focusing on one in particular, which is EIDD 2801. That has been licensed by Merck, of course, from Ridgeback Biotherapeutics. That is an oral antiviral. That one also in trials right now with COVID patients, small trials. So then they've got to move to the larger trials, the same, I guess, as Regeneron does in terms of the larger population for these antivirals, which we should make clear. They're not the vaccine, but they could be very effective, if they are effective, in preventing the spread, because they would be taken very early, potentially on onset, or even prophylactically.
That's right. So Regeneron seems to be out in the lead in terms of novel drugs developed specifically for COVID-19. But as you note, this is a different form of administration. So for the treatment, it's given as an IV in the hospital, or if you are in the prevention trial, given as a subcutaneous shot. That's different, of course, from oral drugs, pills, which would be a lot easier to distribute and to take. So that will be very closely watched, this Merck drug licensed from Ridgeback Bio.